Good afternoon. I'm Walt Bauer, and I'd like to welcome you to the Human Development Institute's third fall seminar. We welcome the participants who are joining us online, as well as the participants who are here with us at the University of Kentucky. Our presenter will provide an opportunity for questions this afternoon, and we welcome questions from all of our participants. Please type your questions in the chat box if you are online. Should you have any questions about CEUs, you can contact me. Please take a moment at the conclusion of the seminar to complete our brief evaluation. The evaluation will be sent to your email address after the seminar. It is really helpful as we plan for upcoming seminars. Now, to introduce today's presenter. Dr. Alyssa Briggs is an assistant professor of pediatrics at the Kentucky Children's Hospital within UK Healthcare. The title of the seminar is How to Navigate the Muddy Road to the Diagnosis of Specific Learning Disabilities. I'm now going to turn it over to our presenter, Dr. Briggs.
Hi, thanks. So doing a presentation with most folks online is kind of a new thing for me, so this is exciting. Also, thank you to those of you who are here in person. These are the objectives I sent out regarding the talk. We're going to try and navigate the various definitions of learning disabilities that are out there, what the clinical definition of learning disabilities are in the diagnostic and statistical manual is different than sometimes what we find in special education, and so it's sometimes it is difficult to get those two worlds to sometimes talk together. We're going to talk about what the process of an evaluation might look like. Given different models in Kentucky, we have two distinct models that special education regulations give us the opportunity to use, and we'll talk about what that looks like. And then we will talk about steps to take if there are any concerns about a kid's academic skills. To give you just a little background on me, I went to Grinnell College, which is a small college kind of smack in the middle of Iowa. I went there with intentions to go into neuroscience, but I also studied sociology and I was interested in the achievement gap. So I taught special education for Teach for America. I taught in St. Louis Public Schools for 2 years. And honestly, I probably would have continued on the path to being a teacher, except for my husband was in graduate school in Chicago, and I wanted to move there to be with him. And I applied to graduate school in school psychology and to teaching positions, and I just kind of decided to go to graduate school. I became interested in school psychology and applied to those programs because I was in teaching special education. I was interested in how some of the decisions were made that led to students kind of being in my care. I got my doctorate in school psychology from Loyola University Chicago. And this is important for this talk because Loyola University of Chicago has an explicit social justice mission that permeated throughout our graduate program. And also it was housed, it's in Illinois, and at that time in Illinois, a lot of research was coming out regarding response to intervention, and a lot of the leaders in response to intervention were in the Chicagoland area. So I kind of grew up in school psychology in a response to intervention world. Then I did my internship at a high school in Highland Park, Illinois, and that is relevant to this talk in that the translation of response to intervention to the high school level is quite difficult. So, my training in response to intervention was quite strong, but then I went in to try and practice that at the high school level. I was met with several barriers. Then my husband got a position at Transylvania University here just prior to my internship year. So that's how I landed in Kentucky. And I started off here as a school psychologist at Lincoln County High School. So I have some experience in the school psychology world in the state of Kentucky. And then I ended up, I also became licensed clinically as a clinical psychologist. So eventually I moved into practicing clinically at the University of Kentucky in adolescent medicine. So basically when I taught teenagers. When I did my internship, I worked with teenagers, and now I talk to teenagers all day long. So teenagers are kind of my people. When it comes to learning disabilities though, and response to intervention, it's just incredibly challenging how to figure out how to make all that work together, especially when kids start to demonstrate impairment in the upper grades in middle school and high school. And we'll talk a bit more about that. Also about my background that's kind of influencing my talk this week. I had a professor at Loyola who was an advocate for kids. She was a former hearing officer for special education, and she had children with disabilities, and she was a fierce advocate. She taught our special education law class, and I also TA'd with her to teach that class one year. And she passed away this Saturday of cancer. And so I feel like I would not be doing her justice if I didn't talk a little bit first about special education law. She also was the kind of person who would, in her advocacy, she didn't really work too hard to, well, how to phrase this in a way. She stood up for what she believed in, even when it was unpopular. And so, you know, I'm going to try and do that a bit with this talk too. There's a lot of controversy around learning disability diagnosis, and I know some people who are listening will, you know, not agree with everything I say because it's confusing and it's convoluted, and I'm ready for that. So in order to do Dr. Marty Wynn justice, we will just lay a foundation for what we are talking about with just a quick background in the principles of law, or of special education law. So right now we have the Individuals with Disabilities Education Improvement Act. We still call it IDEA, even though it's IDEIA, because it's just easier than adding in an extra letter. And it was reauthorized in 2004. So how I conceptualize special education is by thinking about these three circles. And I'm not gonna, for the purposes of this talk, I'm not gonna get into 504, but the three questions I think are helpful to ask is A, is there a disability? B, is there significant interference academically? And non-academic interference is a whole nother ballgame. We'll focus kind of on academics today. And then 3 is the interference so significant that we need specialized, individualized instruction. So if the answer to all 3 of those questions are yes, then we end up in special education. So the purpose of IDEA is to make sure that all children, and that means all children with disabilities, have a free and appropriate public education. Well, that seems pretty straightforward, but it's really not. And we'll talk about this in just a couple slides, but even the definition of what is appropriate has changed over the years. And this education is designed to meet their unique needs, both in school and beyond, right? So we consider in special education, employment and independent living beyond the school-aged years. And part of this also is to ensure the rights of children and their parents are protected. And then another part of the law is to provide states and localities with guidance and to make sure that we're being effective in meeting the needs of children with disabilities. And then when you sit at a table in the school, this is sometimes what it feels like for a parent when you explain kind of what special education is. Like it's alphabet soup, and you're handed all of this paperwork, and it's hard to kind of really figure out how to sort through. And, you know, even some friends of mine who are school psychologists who have kids with disabilities, you know, when they're in a school meeting environment, they talk about, even with all the knowledge they have, just feeling overwhelmed. It's very overwhelming. Which is why, you know, as from the school psychologist perspective, it's always kind of intimidating when a parent brings in an advocate, right? But then at the same time, from a parent perspective, it totally makes sense why you would want an advocate at the table, because in Kentucky, we called it Admissions and Release Committee in ARC. But on that committee, you have to have a special ed teacher, a regular ed teacher, an administrator, or somebody, you know, who can make administrative decisions, a school psychologist, a speech language pathologist, an occupational therapist, and anybody else who's kind of involved in the child's education. And it's just, you know, a lot of people in the room. And then you kind of have, you know, the parent, and that can be a really scary seat to sit in. So there are 6 key principles of IDEA that guide the law. That's, we talked about a free, appropriate public education, identification and evaluation, the IEP, educating kids in the least restrictive environment, due process safeguards for the children and the parents, and then parent and for the schools as well, and then parent and student participation and shared decision making. So again, FAPE means that the nature and the severity of the disability does not exclude a child. It's our responsibility to educate them. What is appropriate used to be what would allow the child to benefit educationally. And now, due to a recent Supreme Court case from 2017, appropriate is appropriately ambitious, which is great because that's, you know, a higher level. But then again, we're also defining appropriate with appropriate. So that's kind of confusing as well. So I think, you know, where some parents feel frustrated is, you know, as a parent, we want our child to maximize their potential. But that is not the job of special education. The job of special education is to help them progress and learn at, you know, a appropriately ambitious rate, whatever that means, right? But it's not to maximize their potential. And that's hard because for parents, we want our kids' potential to be maximized. If FAPE's not provided, you know, parents may be entitled to compensatory education or private school reimbursement. So with evaluation, and I think this is important in the context of the talk, in that evaluations need to be multidisciplinary, they need to be multifaceted, and they need to be unbiased. And all of these key components of evaluations become challenging with the way learning disabilities are defined. It is also our responsibility that if we feel that, you know, a child may have a disability, that we evaluate for that. And I'll talk a bit about this, while RTI does a great service to children, sometimes that gets in the way of child find. The IEP is basically the roadmap. It is the document that outlines all the program and services for the child. It is a legal document. It's developed by the Admissions and Release Committee, and it needs to be followed. It's reviewed annually, but parents or teachers or anybody are always welcome to call a meeting to update and revise the document. The least restrictive environment is, so sometimes, you know, when I'm evaluating a kid, either now kind of in the clinical setting or when I was in the school setting, parents were nervous, well, if my kid is identified, are they going to be put off in some special classroom away from everybody else? And no, LRE says that we don't do that. Special education is not a place. Special education is a continuum of services, and the preference is always to have the child in the general education environment as much as possible. So what this looks like for children with learning disabilities in a lot of schools is that, you know, they're in a general education environment, but a special education teacher may be co-teaching in that classroom. And this is actually how I functioned as a special education teacher. When I taught in St. Louis, I co-taught English with a regular education English teacher. I was a special education teacher. We developed the curriculum together, and then my job was to figure out how to modify that curriculum and specialize that curriculum in order to meet the needs of my students with disabilities. Co-teaching, though, it serves the least restrictive environment. It's also a challenge. It's a marriage. You got to really be able to get along with your co-teacher. You got to be able to jive well. A lot of times it ends up looking like a teacher and an assistant. So it's a really challenging thing to get to work well in the classroom, but when it does, it's beautiful. So this is a way, to kind of conceptualize the least restrictive environment. We want to stay towards the bottom of that triangle as much as possible. And then due process safeguards come into place for both schools and parents and children, because education is considered a property right and it's protected by the Constitution, which is why we have due process safeguards for special education. So no child should be deprived of an education without the opportunity to protest. And children are children, right? They don't know necessarily how to protest themselves, so they rely on adults to be their advocates to protest for them. So due process safeguards surround both consent, or all four of these categories: consent for evaluation, placement, and reevaluation. They mean that parents get adequate notice of when their child is identified, placed, going to be evaluated, what services are going to be provided. It also includes, and we'll talk about this a bit later, that parents are entitled to an independent educational evaluation, and how you go about that can kind of depend. And these safeguards also kind of outline how complaints and due process hearings will proceed. And then the sixth principle is parent and student participation and shared decision making, right? Parents and students should be part of the process. And at a minimum, students should be part of the process at age 14, which is when transition planning should be required. But I think sometimes adults want to protect children from understanding that they have disabilities, yet at the same time, can you imagine going into high school learning that you have a disability for the first time and, to be a part of these meetings? So I think it is important also for kids to be a part of this process. Parents, in terms of the law, it's called parents, but it includes birth, adoptive, foster, legal guardians, surrogate parents. And parents are full participating members of the ARCT meeting. And I think, personally, Briggs's best practice is that student input and participation starts occurring at least in middle school, maybe even 5th grade, but the law says 14 and up. Okay, so that is just kind of a very quick foundation and kind of the principles of IDEA. Again, a lot of these things I'm going to be covering could each in and of themselves be a semester-long course. And when I did my school psychology training, each and of these things were a semester-long course. So I took a semester in just IDEA, right? So it's a lot of information coming at you, and I'll give you some resources at the end to where to kind of go and do some more research on your own. So what is a learning disability? What can we agree on? That is the question. So just some brief context and history. Learning disabilities became a concept in education around the 1960s. There's been a lot of research, a lot of legislation, a lot of improved practices, but our definition of a learning disability has gotten murkier and less unified. The issue is, before we can accurately and adequately assess for learning disabilities, we need a valid common definition. Yet, I don't think we really have one. And I think that's one of the reasons why this road to learning disability diagnosis is pretty murky and muddy. What we do know when it comes to learning disabilities is that there is some unexpected underachievement, and that it is likely the result of impaired cognitive processes, but even saying that it is the result of impaired cognitive processes is up for debate. We can't really quite demonstrate whether those processes are a cause, a correlate, a result. So we just don't have enough neuroscience knowledge, I think, to really tease that out. We do know that learning disabilities are heterogeneous, so they're varied, right? They occur across multiple academic areas. You could have a kid who really struggles in decoding and basic reading, but can do just fine when it comes to math. You could have a kid who can't do math calculations, but if you give them a calculator, everything is mostly okay. You can have a kid who could give a beautifully coherent verbal presentation, but not be able to present you with an organized and coherent paper, right? So they're heterogeneous. They vary from child to child. What we do know, though, is that the vast majority of learning disabilities occur in reading. And because of that, that is where most of our research is too, as well. So we have a lot more research in learning disabilities in reading than in math and writing. So all the disses. So in school psychology practice, according to our National Association of School Psychologists, and also according to the Diagnostic and Statistical Manual, we're kind of advised that dyslexia is a specific learning disability or disorder in reading. Those two terms are one and the same, but to prevent confusion, we're advised to use the specific learning disability because that's kind of what's unified across special education and the DSM. But if you look in the DSM, you know, it breaks out specific learning disability in reading to difficulty with fluency, to difficulty with word identification, to difficulty with using phonemes, to difficulty with comprehension. And so there's opportunities to kind of specify the different types of learning disabilities you see in reading. Same thing goes with math and writing. So dyscalculia, we're advised to say specific learning disability or specific learning disorder in math. And dysgraphia, we're advised to say specific learning disability or disorder in written expression. So when I say specific learning disability or learning disorder, I'm not meaning to do a disservice to dyslexia, dyscalculia, or dysgraphia. Kind of the way my mind works is that we're talking about the same thing. And the reason why I'm saying disability/disorder is that IDEA, special education, says disability. The DSM says disorder. The DSM used to say disability, and now it says disorder. We'll talk a little bit about that in a second. So there are 3 different definitions of learning disabilities out there, and if you put these different authors in a room together, it would be very entertaining. They do not agree. I'm sure we could help find some common ground, but you know, there are arguments between them in the literature. So the camp I was trained in is response to intervention. And that is basically, you know, you have a dual discrepancy. You have unexpected underachievement, and then you have, despite evidence-based interventions, that child is just not moving at a rate of progress that is going to get them caught up. You have the patterns of strengths and weaknesses model, which according to Hale is distinct from the ability and achievement discrepancy. So the pattern of strengths and weaknesses model is that, you know, there's unexpected academic underachievement, again, but that this is related to a processing weakness. So some kind of processing weakness, whether that be the deficit in visual spatial processing, whether that be a deficit in working memory, that, you know, could be in many different areas, but we were able to pinpoint some sort of processing deficit. The ability achievement discrepancy is that there is a significant difference between cognitive or intellectual ability or some measure of ability and academic achievement. If the ability achievement discrepancy could work, it would be lovely because it's just so clear cut. If it could work. The trouble is that in terms of the literature, it's the least supported method. If you interview school psychologists, they'll tell you that they rarely prefer it, and that it leads to over-identification of racial and ethnic minority children. So if you're an ability and achievement discrepancy person, maybe by the end of this talk, I will have changed your mind. If not, I apologize, because I can find benefits of it. I can, but, and we'll talk about that, but it's hard for me. So, and again, I come from the RTI camp, so keep that in mind as well. That's how I was trained. But so response to intervention really is a form of dynamic assessment. So what this means is that, you know, instead of bringing a kid into my office and giving them a 4-hour battery of tests, you know, we're really kind of examining their achievement and their response to different interventions and problem solving over a period of time. So really, as a clinician in a clinic, as much as I love RTI, I can't really do it, right? I have to rely on collaboration with the schools in order for RTI to happen. RTI is multi-tiered, and we'll talk about that in a minute, but the idea is that we increase the intensity, and that could be in frequency of the intervention, how long the kid gets an intervention, what size group the kid is pulled out into, whether it's, you know, a group of 5 or even just one-on-one instruction, and the expertise of the person providing that intervention. There are 2 options for this process. There's the problem-solving approach, where, you know, you identify that the child's underachieving, you review different sources of data, you determine the best research-based approach to use, you implement it, and you evaluate their response, and then kind of go on, you know, through that cycle. Or there is the standard treatment protocol approach, which is what you'll see more often at the high school level, just because of the way high schools are structured. And that is, you know, this kid didn't meet the college and career readiness benchmark on the ACT, so we are going to send them to an extra math intervention class and see if we're able to boost their, you know, their readiness score on the ACT. And that would be kind of a standard treatment protocol, that they get, you know, this evidence-based intervention for this amount of time, and we'll see how they respond to that. But it's not really an individualized problem-solving approach. But with response to intervention, data is the driving force. The hard part, well, there's many challenging parts to response to intervention. One of the challenging parts is that it requires us to really define what responsiveness and non-responsiveness is. And there is a lot of debate between different professionals, between different school districts, different states. I mean, wherever you go, you may find a different operationalization of what non-responsiveness is. One that you could use is that non-responders are those whose slope and level of performance is at least 1 standard deviation below their class mean, or that could be a district mean, or it could be a national mean. So let's say, you know, on one assessment of reading fluency, the class mean, you know, was at a certain level, the district mean was at a certain level, the national mean is at a certain level, and, you know, the child falls 1 standard deviation below that. And they also, if you kind of look at how they did on this particular measure over time, that slope, that line would be 1 standard deviation below kind of the class slope. And there's a variety of different measures that could be used to assess this. There's a variety of different curriculum-based measures, and I'll show you kind of a resource for finding those. So, you know, I'm on the Facebook, and there's a group called, I'm part of 2 groups. One is Said No School Psychologist Ever, and one is School Psych Moms. But anyway, sometimes my school psychology friends post these memes. I guess you'll leave this talk being like, wow, Briggs is really on Facebook an awful lot. But anyway, these are some of my favorite school psychology memes. If you're going to show up to a meeting with a school psychologist and you're concerned about a learning disability and the district is an RTI district, you got to show up with some data. So why RTI? Well, the one thing that people in those three different camps can agree on, I think, is that it does have value in that we don't really have the luxury of waiting. I don't think anybody really says we want to wait until this kid fails enough to qualify them as having a learning disability. I don't think people really want that. Sometimes that ends up being what's happening, but I don't think anybody goes into education wanting that. And so if we intervene early in any area, in speech, in OT, in mental health, the earlier we intervene, the better outcomes we have. And that goes for reading. So early intervention, we can get poor readers, most of the poor readers up to the average range. If we wait until age 9 to do something differently, we'll have 75% of those kids experiencing lifelong impairment. So RTI just makes sense from that perspective alone. It's our responsibility to intervene if we want children to leave our schools being proficient